My presentation will be on chlamydia. So just a brief introduction to chlamydia and to STDs in general. They are being faced all around the world. They're very prevalent, especially in America. They cause more complications among women, and that's mostly because of the female anatomy and how a lot of them are spread through secretions, and there's just a lot of secretions that exist within the female anatomy that causes them to be more likely to contract these diseases. Chlamydia is the most common STI, and it is endemic because it is always prevalent, and it cannot be eradicated. It can cause infertility in women. In fact, it's actually has a nickname as being the silent sterilizer because a lot of people don't know they have it and it ends up causing fertility in them. And with this STD, it is required by law that if somebody has it, they have to report it because it needs to be reported, and the local healthcare center needs to be notified because it's a really big deal if someone in the community has it. So, a little bit of microbiology about this pathogen. So, the technical name is Chlamydia trachomatis, and bacteria in this phylum do not contain peptidoglycan in their cell walls, and they are obligate intracellular bacteria and lack many metabolic pathways, meaning they can't survive on their own. They need a host cell for their metabolism. And basically, the way that they spread is hemagglutinin facilitate attachment to cells, which causes an immune response in the body. They exist as elementary bodies, and these are the infectious part, and then the reticulate bodies, which causes them to reproduce. And they can't reproduce on their own. They have to have a host cell. So how that works, I have like a little picture. So the red dots are the elementary bodies, and those are the infectious disease that enter into a cell. And then once they're in a cell, they turn into a reticulate body. Those reticulate bodies then multiply and create new elementary bodies, and the whole cycle starts over. So the nature of reproduction in chlamydia is very cyclical in nature. This disease is transmitted through oral, vaginal, and rectal sex. It basically is transmitted when you come into contact with those infected fluids, and that happens through those forms of sex. And it also can be transmitted from a mother to a baby during childbirth, which is why it's really important that when women become pregnant, they're tested for chlamydia, because the providers need to be aware of the fact that the child might also become infected with chlamydia. People that are at risk for getting chlamydia are mostly women because of what I talked about before with just the anatomical differences. Women under the age of 25 are at a greater risk for getting chlamydia. If you have a reoccurring STI, there's also a decent chance that you'll obtain chlamydia. Unprotected sex and multiple sex partners. So when educating people about trying to be safe from these STDs is really, really important for this age group and women, especially to educate them on how to have protected sex and about having fewer sexual partners. Signs and symptoms of chlamydia, because especially it is a cervical infection, is that there are abnormal vaginal discharge. So not just like normal, but like a greater amount, a different smell, something like that would be considered abnormal. A burning or an itching sensation when urinating, lower abdominal pain, pain during sex, and you could also have symptoms such as nausea and fever. But remember, most cases of chlamydia, the patient is asymptomatic. The way that chlamydia is tested for is there are two normal ways, and that's a urine test or a swab of the vagina. And basically, what these diagnostics are looking for is direct immunofluorescence, enzyme immunoassay, or nucleic acid amplification. And these tests are pretty clear as far as the sensitivity to the diagnostics. So it's pretty conclusive to test. So if you test positive, then it's likely not going to be a false positive. Chlamydia can be cured, which is not true for all STDs. And the way that you cure chlamydia is because it's an infection, it's cured by antibiotics, and specifically trecycline, which is given intramuscularly, and doxycycline, which is an oral antibiotic. But because doxycycline is um, harmful to children, if the client is pregnant, then they have to be treated with azithromycin instead, so that they don't run the risk of harming their child. And then also because of that, babies that have chlamydia will also be treated with azithromycin. And then it's really important that if you're in that age group especially, but really if you're having active sex, and especially with more than one partner, or using IVs or anything that could expose you to fluid, it's important that you have screening of chlamydia so that you can catch it and treat it early before it becomes a bigger deal. There are a lot of impacts and complications of chlamydia that a lot of people don't realize because it can be cured. A lot of people don't think it's a very big deal, but as I mentioned before, it can cause infertility in women, and is a very big cause of infertility. So that's why it's really important to know if you have it and to treat it. It can also cause ectopic pregnancy, which is dangerous for you and can also cause a woman to be infertile if she gets it, because women have the potential to lose their tubes if they have an ectopic pregnancy. Pelvic inflammatory disease is a complication of untreated chlamydia, and it's just a disease that causes pain and just inflammation to the pelvic region of the body, and it's not a good thing to have. Conjunctivitis in babies, which is an eye infection, that can come from babies that are infected with chlamydia from exposure with mothers that have chlamydia. And then just the psychological impacts of having an STI are really important to remember. A lot of people just are ashamed, and it makes them feel dirty, and they're afraid to admit it to their providers because of the shame they carry. So it's important to just be non-judgmental, and to remember that there's a lot of stigma that comes with having an STD. So in conclusion, chlamydia is the most common STD. A lot of times people don't realize that they have it because they're asymptomatic, but it can cause infertility in women. So it's important for women to be screened for it so that they can be treated early before complications occur. This disease can be passed to babies, so that's another reason why it's important for women, especially pregnant women, to be screened for this and to begin their treatment.